I would like to talk to you about SAMe, whether you're an individual considering using SAMe for yourself or a clinician figuring out how to use SAMe in your clinical practice. So SAMe is a naturally occurring methyl donor, and it has gotten a lot of attention because it has quite a bit of research evidence supporting its benefit for mental health. It also is helpful for things that have nothing to do with mental health, for example, for joint health. So SAMe participates in over 100 methyl transfer reactions in the body in all kinds of different metabolic pathways. It's involved in DNA methylation, so it's turning genes on and off. And of course, through that, it has a big impact on health. It's also involved in neurotransmitter synthesis. And abnormal methylation, we know, has an impact on brain disorders. So this might be a treatment that's like a root cause treatment to address an issue with methylation of genes that might be contributing to mental health issues. And SAMe is an antidepressant through a few different mechanisms. It enhances neurotransmitter synthesis. It alters neuronal membrane fluidity in a positive way, and it modulates neurotransmitter receptors and transporters. Of course, there's probably a lot more that we don't know about how it works, but these are some clues for how it might be working in the body for mental health purposes. And studies have shown that SAMe is an effective treatment for mild depression. It's very popular in Europe, less popular in the United States. In research studies, it was used up to 1,600 milligrams per day. Most of the research was on lower doses, like 800 milligrams per day. The doses that are easily accessible online are either 200 milligram tablets or 400 milligram tablets. It's also not cheap, and it has to be bought in blister packs because it's oxygen sensitive. So it has to be the right form in a blister pack. It has to be taken on an empty stomach about 20 minutes before breakfast. And I recommend to start low and to increase the dose gradually to avoid side effects. It has one amazingly helpful, wonderful plus. It works quickly. So while regular antidepressants, sometimes we have to wait 3 weeks, 4 weeks, even longer, SAMe, within the first week, there should be a pretty good sense of like, okay, this is going to work, or nothing, this is not going to work, right? You maybe need to increase the dose, but it pretty quickly will do something, right, to improve mood. A warning, it's an activating supplement. So for people with any tendency towards hypomania or mania, and this could happen even in people who never had hypomania or mania, SAMe, especially at high doses, could induce hypomania or mania. This is, of course, infrequent and rare. In general, this is considered to be a safe supplement. But if you have any history of manic episodes or hypomania, caution with the supplement. And it's also activating. It's something to take in the morning, and even without any tendency towards hypomania or mania, like someone may feel just like more energy, right? Sometimes my patient described this as like this mental energy, like wanting to work on something intellectual, or being kind of the brain being faster at work, which is maybe like another wonderful side effect and aspect of this supplement. In general, my patients like it and stay on it. Often it's added as an add-on to an antidepressant for moderate or severe depression. It can be used as a standalone treatment for milder depression. So for sure, run it by your prescriber or therapist or primary care doctor, whoever you're working with, to have their knowledge and also to see if they agree with this treatment for you. But it is one potentially effective and beneficial for things in addition to the brain treatment, to either add on to antidepressants or try on its own. Thank you for watching, and please let me know in the comment section about your own experience with SAMe.